This is Dr. John Whitcomb talking about thymosin beta 4. This is one of the top 3 peptides we're being told everybody should have in their practice. So it's an important one to know about. Why is it called thymosin beta 4? It was found in the thymus gland. That's not the only place it is. In fact, it shows up abundantly just about everywhere, but most importantly, for example, in platelets. What do platelets function as? They are the first little devils to show up at the site of an injury. When you have bleeding, platelets are the very first thing that comes along and plugs up the bleeding. And they're loaded with thymosin beta 4. And that starts setting out the architecture, the actin molecules that line up together that create the structure around which new cells can heal. So it's like setting up the scaffolding for healing, or the railroad tracks for healing is another term that's been used. So thymosin beta 4 is a hugely important peptide. How do we use it? Well, with BPC 157, it might be a huge healing agent. It's now been used in dry eyes to wonderful effect. Folks have had dry eyes get better. There's a patent in Europe towards using it for multiple sclerosis. There's surgeons who will say they'll never operate without it. Thymosin beta 4 might be one of the most important peptides you ever hear about. So think about getting used to thymosin beta 4, TB4. You might be using it a lot. If you're having surgery, oh, please talk to somebody about how you can use it around the time of your surgery. If you have a wound on your leg, if you have an injury somewhere, you might combine it with BP 157 and just see how much better you do. But meanwhile, you'll be hearing more about thymosin beta 4. It's your natural healing peptide. So this is Dr. John Whitcomb talking in News and Nutrition on thymosin beta 4.